You for being here again, for staying up to date. We have a long list of updates to share with you today on all of our response and efforts to slow the spread of COVID-19 throughout our entire state. But before I provide some of those updates and ask others on stage to do the same, I did want to just recognize that we understand how hard all of these efforts and this response is on Hoosiers as we all collectively try to flatten the curve and slow the spread. Indeed, these are times that try our souls. But I will also, at the very same time, say that I'm more convinced now than ever, because of folks that we're all hearing from, folks that I read about throughout the state of Indiana who are stepping forward in that special, unique Hoosier way to assist, that we are going to come out on the other side, for sure, with some painful losses, but in many respects and in many ways stronger for it. I realize not everything is in our control, never has been, never will be. Pathogens are part of our ecosystem. This one is novel, and it is lethal, and there's no vaccine yet. But as it turns out, sometimes the best defense is a good offense, and we have to go on offense to slow the spread. That means each and every one of us, as I said just a couple days ago in this very atrium. I know we can't control everything, but we can, as Hoosiers, control our individual behavior and our own actions. And that means practicing good social distancing. That means washing your hands again and again and again. That means donating blood at the Red Cross. That means expressing your love for your neighbor, not maybe in person, but checking on them on a consistent basis. You know who they are. These are all things that we can do regardless of whether you're 18 or you're 80. So understanding that we're digging deeper than maybe some of us ever have, it's going to require us to do some soul searching, and all of us enlisting in this fight to beat back this pandemic. And again, I mean everybody, because there is no greater civil liberty than the liberty to not being infected by irresponsible actions and behaviors of others who would dangerously impact the health and safety of our fellow citizens. So here's to our persistence, here is to our personal responsibility, and here's to our confidence to finish this marathon. And to put that marathon into perspective just a little bit here, on March 6th, as you all recall, we had our first case of COVID-19 in Indiana. Today we have 56 such cases in 22 counties, and sadly, 2 deaths. And let me just say here at the outset that every county, all 92 counties in our state, is stronger because of the Lilly Endowment and the Lilly Foundation, and to see Eli Lilly and Company yet again step forward to improve Hoosier lives in such a profound way as they announced with Dr. Box yesterday. The employees of the Eli Lilly and Company define what corporate citizenship is all about, and their civic duty is a standard that is, of course, exampled all over the state of Indiana. But for them to step forward yet again, this is an honorable company, and it has been ever since the days of the colonel, the founder. So I just want to shout it out from our State House, just how appreciative we are to Eli Lilly in partnering with our State Department of Health to ramp up our daily testing capabilities And with that, I would just ask if Dr. Box could step forward and give you further updates, more detailed, on the progress that we've made over the coming days and over the course of the coming days still on testing and supplies. Dr. Box.
Thank you, Governor. First of all, Hoosiers, I want to thank you for everything that you are doing to help us protect our most vulnerable populations. Please, please continue to social distance and take care of each other, because the steps that you are taking really do matter. It is something that you can do as a Hoosier for your community and for our state. You can make a difference. I want to make sure that you know we have a real-time look into all of our hospital systems across the state, so we know what they're experiencing and what their needs are and how those needs change on a minute-to-minute basis. Right now, they update that on a daily basis. We may get to the point they're updating twice a day or more often than that. If hospitals are facing critical shortages of supplies, such as masks and gowns, we know immediately, and we will help in whatever way we possibly can if their normal supply channels cannot satisfy their needs. Our focus also includes long-term care facilities, dialysis centers, because we know those facilities serve people at the highest risk of severe illness. As this outbreak continues, the needs will shift, and we will adapt to those needs to the very best of our ability. Every state is dealing with supply and demand changes. That makes it especially important that people with mild illness continue to stay home. Isolate yourselves. Do not go to emergency rooms so that hospitals can conserve their personal protective equipment and deal with the most critically ill patients. I'm pleased to let you know that we are seeing more private labs testing for COVID-19 and that partnership with Eli Lilly is expanding testing across Indiana. To date, we have received over 400 results, and you should expect to see the number of Hoosiers that are tested growing quickly beyond just the State Department of Health's ability to test. This expanded testing also means that we are streamlining our process for healthcare providers and encouraging them to use their good clinical judgment as to which patients need to be tested. Keeping in mind always that we have limited amounts of viral swabs, viral transport media, and the personal protective equipment needed to actually obtain these swabs. We will continue to focus on testing in our highest risk patients, such as those who are hospitalized, healthcare workers, residents of long-term care facilities, individuals who live and work in them. On a final note, I want to remind everyone that most individuals with mild symptoms do not need to be tested. Even with expanded testing options, we still have a shortage of supplies, and we need to be mindful of that. As testing increases, we expect to see our number of positive cases grow. I urge Hoosiers to continue to adhere to the social distancing guidelines that have been outlined and limit your gatherings, meeting virtually whenever possible. Stay home for sure if you're sick. And make sure that if you're sick and you're diagnosed with COVID-19, that you contact the individuals that you have been in closest contact with, especially if you are working with that most vulnerable population in hospitals and long-term care facilities. These are challenging times for us, and I know that many people are experiencing hardship because of the steps that we've taken. But I am confident that following these guidelines is the best way that we have as a state to impact COVID-19 on our state. Hoosiers, this isn't over. Do not relent in the steps that you're taking to protect your family and your friends and your neighbors. I sincerely thank you for everything that you are doing to help us to flatten this curve.
Thank you, Dr. Box. Next, I want to thank Superintendent McCormick, Speaker Houston, Senator Bray. I see Senator Rotz, Representative Baining here, Senator Cruz. Thank you all for your leadership and the collaboration during these unprecedented times. And I also want to underscore what we talked about when we were last together here, and really thank the teachers and the principals and the superintendents for really rebuilding an airplane in flight over these last few weeks. They have turned and burned. And so wanted to add some certainty to some uncertain times, and therefore directing all schools to be closed until May 1st. As we get nearer to May 1st, we may have to close permanently, but we'll make that call down the road. Superintendent McCormick and my team have been in constant contact with the U.S. Department of Education, and we're making sure that they know that we'll be applying for a waiver so that we don't jeopardize or lose any funding in our efforts to keep our kids healthy and safe. And lastly, if, and I stress if, by some miracle, we get students back this year, we'll use that time in class for instruction, not cramming for tests. So I'm canceling Indiana's student assessments for this school year. Let me just add, yesterday, I personally spoke with U.S. Secretary of Education, Betsy DeVos, and informed her of our, not just intentions, but decisions. Secretary DeVos could not have been more interested in removing all barriers and giving us, other states, as much flexibility as we need so that we can creatively and productively use our time now and our remaining time in this school year to instruct our students. On a side note, I just talked to a teacher in Carmel this morning who said that he had never done e-learning before, so they spent 10 plus hours on Monday and Tuesday cramming themselves, getting up to speed. And yesterday was a very successful day, up and running, full speed, very few hiccups. And today, as of just a few moments ago, he said it has been completely smooth. You talk about effective. That's making lemonade out of some lemons, if I've ever heard it. I also, in that conversation with Secretary DeVos, talked about what's been on Superintendent McCormick's radar since early on, and that is, and it's certainly been on parents' radars too, that's, how we're going to handle our 75,000 seniors and all the graduation requirements during these unique times. And so I thought, Superintendent McCormick, if you could shed some light on the decisions that are being made real time and the ramifications that are going to have over the coming weeks and months.
Thank you, Governor Holcomb. I do want to commend the governor for taking these bold steps. You're going to get criticism no matter what you do in situations like this, but we had a lot of conversation on what these steps look like, and I do commend him for pulling that trigger and making that decision. I will say school closure to May 1, I cannot emphasize enough, as Governor Holcomb said several times, this is the first step. There may be a need to come back and revisit that for the extended school year based upon what is happening in the dynamics of the situation. But thank you, Governor Holcomb, for doing so. I also want to thank the Department of Education team, who has been amazing. The local administrators, educators, superintendents, again, I cannot thank you enough for the work that you're doing. I also want to thank the parents. I know this in families, this is a very, very difficult time on many different levels. So I want to make sure that the families know how incredibly thankful we are. To the kids, this is my message to you. Be positive, make good choices. Stay on your work that you have at home. It's extremely important that you are a good partner in this. So for the 20-day waiver that the governor gave us on March 13th, what that means is for schools who are not taking advantage of e-learning, that they don't have the mechanism to do so or have made a choice not to do that, they do have 20 days that will be counted as instruction. The governor and I have had conversations regarding we may have to visit that number, and the governor has been very gracious in understanding that, so we may be coming back to this podium to discuss that 20-day waiver. In addition, on assessments, so that we are clear on what that means, the assessments that are impacted for the state of Indiana for this school year are iRead 3 test takers for grades 4 and 5, those are our retesters, iLearn for grades 3 through 8, iStep for grade 10, and we were in the middle of it. Some of our schools might have completed that assessment, others of our schools haven't started, and some are, it's just very fluid where people are participating, but that is canceled. IAM, which is our alternative assessment for our most at risk. Our WIDA screener for those who are not participating in e-learning for our EL student population. And our iSprout, which is our assessment for our pre-K students for those situations where they are not open and operational. So those are the assessments that have been outlined as a cancellation for the 1920 school year. We have had a lot of questions about the assessments that are not state mandated. We are working with those vendors. It is a very difficult situation, and we know there are opportunities for students and families that are impacted, and we will continue to have conversations. Regarding our seniors, we hear you. I've received your emails. Families, I know this is a very anxious time. Our goal is to make sure that we graduate seniors. We have a lot of students who have already met that threshold and will be in good shape. Our charge is now to pay attention to those students who have credits that they need to earn, and how are we going to work with our districts to make sure that we get that in for our seniors. I know the ceremonies are also of issue. Our local schools will be making some of those decisions, but as far as the credits and the opportunities and the pathways, we will be making some guidelines and putting those out and working with the governor's office. Our waiver for food is also impacted by this decision. The governor has been gracious again as far as making sure he supports that waiver. At this time, 94% of our districts are providing some type of food through the USDA program or food access through local programs. So to our local partners who are making that happen, thank you. We cannot thank you enough. Our schools are not just taking care of school-age children, they are taking care of families. So again, the announcement today I know is taxing on a lot of people, but I think it's the right thing to do for the wellness and the healthiness of our students and their families. Thank you.
Thank you, Dr. McCormick. Next, I'd like to ask Chief Justice Loretta Rush if she would give another state of the judiciary again this year. Seems like you just did this a couple months ago.
Thank you, Governor Holcomb, and I appreciate your leadership. And I will tell you that Indiana's judicial branch is taking its lead from the Department of Health with regard to what we can do to our role with regard to mitigating this crisis. A couple of things. We have an administrative rule in effect. It's called Administrative Rule 17. Every county has a continuation of operation plan with regard to how essential court operations are going to continue. Courts.in.gov/COVID has those plans. We are adopting those as they come in, and it'll say which essential emergency functions are being done. We're seeing jury trials continued. We have technology in place, and I have to thank the legislative branch for helping us modernize our court operations over the last couple of years, which really can put in social distancing. And here's one example. Since last week, 250,000 legal filings have been done electronically. That means 250,000 people are not going to the courthouse with regard to filing documents. We ask you not to go to court to check on your case. You can check the status of your case online on mycase.in.gov. A lot of issues are coming up with regard to this. We have indianalegalhelp.org. If you need financial help and assistance, it's a website that you can go to. So our courts are open for emergency essential hearings. If you go to the website, you can find out what's going on in a particular county. We've given guidance. We're tolling statute of limitations. If you're worried about filing something and missing a date or a marker, we are postponing jury trials, both civil and criminal. We're being mindful of individuals' constitutional rights with regard to the continuances. But when you look at child welfare hearings, adult guardianship hearings, and voluntary commitment, any of a number of emergency hearings, we will be holding those, and all information about the courts can be found by this website. Thank you.
Thank you. Every day, in fact, you've heard it here a couple times already, every hour, every minute, our COVID-19 task force is focused on three fronts. We're focused on public health, we're focused on public safety, and of course we're focused on the state of our economy. Earlier this week, I requested the U.S. Small Business Administration to basically make a disaster relief, low-interest loans available up to $2 million for our 512,000 small businesses nestled all over the state of Indiana. And yesterday evening, that was approved. I cannot express my appreciation for, you talk about turning and burning. This is not at the typical speed of business. And so we appreciate the federal partnership that we have in place as well. We also need to make sure that we get that word out far and wide. The Lieutenant Governor has been on the phone, hosting conference calls nonstop this week with various industry groups and associations, making sure that we have the latest G2 and information, what's happening on the ground, how it's impacting and affecting their business model. And we'll continue to do that as the days ahead unfold. Obviously, the word fluid was mentioned here earlier. Things are moving fast. Things are changing. If you think about earlier this week on Monday, our unemployment rate was reported at 3.1% earlier this week, 3.1%. To put that in perspective, this exact week a year ago, we had 3,100 Hoosiers file for unemployment insurance benefits this week last year. Over the course of the last 3 days, the same week a year later, Monday, Tuesday, Wednesday, we've had 22,583 Hoosiers file. 3,100 a year ago, 22,000 plus Monday, Tuesday, Wednesday of this week. Yesterday, I also spoke directly with the U.S. Secretary of Labor, Secretary Scalia. I shared with him these stats, real time. I thanked him for the $100 million grant fund for dislocated workers, which can apply to retraining and other initiatives as the jobs are changing. But I just want to underscore just how important it is for a Hoosier, any Hoosier who has been laid off, to go to unemployment.indiana.gov and apply. It starts there. We can start answering your individual questions there. You can call for sure, but you can also do this online. It's very efficient, and we'll keep up to speed with what's going on in your life. We're going to do everything in our power and in our ability, along with our partners, of course, in Congress and in the President's administration, to bridge where we are now to that day where we completely bounce back. I've asked, as I mentioned a couple days ago, every agency in this administration to do a deep dive and see what things that they need to be doing differently to meet Hoosier needs during this storm. And you'll hear from our OMB director here in just a second, Chris Johnston, but we've got a long list that I think you're in possession of now. He'll highlight some, but it includes delaying your state income taxes due on which normally would have been April 15th, just right around the corner, to July 15th. And we'll be waiving the penalties for 60 days for property taxes that were to be due on May 11th. And so, Chris, wherever you're hiding, if you want to go through the whole long list of different agency initiatives that we have underway as of today, please do.
Good afternoon. What I'd like to do is dig a little deeper on a couple of the items that the governor has mentioned regarding income taxes and property taxes, and then also give some examples of the engagement of the agencies across all of state government regarding efforts to deploy resources and be responsive to the citizens and businesses most in need. As the governor mentioned, the Department of Revenue later this afternoon, we'll be putting out guidance to align our our state income tax payments with the federal government's dates. And so those payments that were due on April 15th, not only the settlement of your income tax filing on April 15th, but estimated taxes will be extended to July 15th. One difference, though, between the federal government, and this may have changed, but one difference between what the state of Indiana is doing and the federal government is doing is we are also extending the filing deadline. The federal government extended the payments, but they still wanted your return filed with the IRS. We are extending both the filings and the payment date. The reason that we're doing that is that some people cannot get to their accountants. They cannot get out and get that work done. The CPAs that might be doing some of that work for businesses, small businesses, and individuals do not have the opportunity because they're social distancing as well to get out and serve their clients. And so we think it was only proper to extend the filing along with the payment date. Good news, though, we have already processed 1.9 million returns. The state of Indiana processes about 3.4 million returns, so we're well into that. And out of those 1.9 million returns, $1.25 million are refunds. Or excuse me, 1.25 million returns have refunds. The Department of Revenue is currently processing returns that are filed electronically in 10 days. Paper returns with refunds are being processed in 19 days. So if Hoosiers are expecting a return, still file your return and do it online if you can to get that refund in 10 days. You might be asking, well, what does this deferral mean to the state of Indiana's fiscal situation? April is our largest collection month, estimated at $2.2 billion. And it's also our largest income tax month for collections. This will make a significant dent in those collections, maybe 40 to 50% in that month to be collected later in July. Some people have asked about what about deferring other taxes, such as sales tax, food and beverage, and innkeeper's tax. We continue to evaluate all ways to assist individuals and small businesses, but we also have to provide essential services for the taxpayers and citizens that need them. Sales tax is the largest revenue stream for state government to provide those services, and so we're moving diligently yet deliberately in the evaluation of those options. The governor also mentioned about the waiver of penalties on property taxes that are due May 11th. Counties have been preparing their property tax bills for some time, and to pull that back in and start over is just not a feasible option. So the due date is still May 11th for your spring installment, but any penalties for not paying by May 11th will be waived for 60 days. The state stands prepared to work with county governments in the event that there are any cash flow stress situations out there around the state. One other thing that I want to revisit is a piece of legislation that the governor offered and the General Assembly adopted. It was regarding the cash funding of the university projects, close to $300 million. We will be suspending the cash funding of that. But the good news is the legislation or authorization for bonding is still in place. So these projects are not, they all have their own project life cycles. And so they're in different stages of development and as far as in need of resources. So we are going to be monitoring that situation. The ability to hold on to that cash obviously gives us greater flexibility. And as the revenue situation plays out over the course of this year, we'll be making further decisions about whether to use the cash or bond for those projects or possibly a combination of the two. The governor mentioned engaging and activating all of state government as far as looking at ways to deliver services and deploy resources to our citizens. And so I'd like to talk about a few of those. At Department of Workforce Development and Unemployment Insurance benefits, and these are just a couple of examples. There's a litany of all of these things that we're working on. Benefits will be paid to individuals who file their initial unemployment claims late. The individuals will continue to accrue unemployment eligibility if they take leave because of COVID-19. In the housing area, there will be no residential eviction proceedings or foreclosure actions that may be initiated during the public health emergency. Housing will also extend deadlines for housing assistance recipients or requirements for eligibility documentation. In the social services area, job search requirements normally required for TANF will be waived. In the Department of Insurance, the Commissioner of the Department of Insurance will request that insurers institute a 60-day moratorium on policy cancellations for non-payment of premiums. The Bureau of Motor Vehicles will waive late fees for a myriad of IDs and driver's license. Department of Veterans Affairs will qualify veterans for awards from the Military Family Relief Fund, even if they don't meet all service requirements. And finally, in the health professional licensing world, mental health professionals will be permitted to practice via telemedicine. Advanced practice registered nurses are allowed to provide services in multiple locations when normally they are restricted. Those are just a few examples of things that the state government is working on. And I'd just like to close at saying that we have great agency leadership and program managers in state government that are working diligently in all of these areas. And while the cash flow and fiscal situation will be challenging in the near months, I'd also like to recognize the Auditor's Office and the Treasurer's Office in working with OMB and the other state agencies as far as communication and managing through this.
Thank you, Chris. As Chris alluded to, he used the word many, and they are, and you can expect many more executive orders to come, again, as the days ahead unfold. Don't misinterpret that statement to say that we're in need of a special session at this moment. We're not. That's just not my opinion. Chris talked about, the budget director talked about what kind of strain this would have on our budget. It will, for sure. But we are living in a state that is on sound fiscal footing. Good thing that the legislature and previous governors were committed to this fiscal management. It has put us in a strong position to weather such storms. But I would ask Senator Bray and Speaker Houston if you would share a few words. We've been in constant communication as well. But like all of the administration, you two are waking up every day hearing from constituents throughout the state of Indiana and your members, making sure that we're all doing all we can to meet Hoosier needs during this hour.
So thank you, Governor, and I want to thank the Governor, Lieutenant Governor, and your team for the amazing work that you've been doing, Dr. McCormick and your team for what you're doing to support schools, and the Chief Justice and your team about how we support the judicial system. As the Governor noted, these are extraordinary times, and our first and primary focus in every communication we've had with the Governor and his administration is how do we support the Hoosier family, and the Hoosier business. And these are the announcement today of these steps is a positive for Hoosiers, and we will continue the work to make sure that we utilize our resources and reserves in a way that has the most impact to Hoosier families. I just appreciate and I'm grateful and thankful for the decisive leadership of the folks on this stage, and we will continue to collaborate and work together to make sure that we invest all of our resources and our time and efforts in helping Hoosier families adjust to these changing and uncertain times. So with that, thank you, Governor, and Senator Bray.
Well, I want to mirror the speaker's comments and say thank you, Governor, and also the others who are up here on stage and put so much effort into this. But Governor, in particular, your leadership and the decisiveness and your ability to collaborate both with members of your cabinet and administrative heads, as well as other elected officials, private industry, and obviously the legislative branch, including the House and the Senate. We have been in constant contact. I have certainly been in constant contact with both the governor and his staff as we've looked at things, efforts to try and slow down the growth of this crisis. And as we try to tackle the challenges that we face, both with regard to Hoosier health, the education of our children, and the challenges the business employees are going to face in the coming weeks and months. And I want to applaud the governor for the steps he's taking today. And we will continue to be supportive and try to add the assistance that we can to this process. But we want to thank you, Governor, for your efforts, and we'll continue to work with you in the coming days and months.
Well, I think that's a wrap on a slow news day. I'm assuming you might have some questions.
So, Governor, the May primary, your emergency declaration sends 30 days out. The primary is May 5th. Do we have a primary? Is it all mail-in? Where are we with the primary?
Under discussion as we assemble here. I have been in discussions with the Secretary of State, Connie Lawson, and she has been in communication, in constant communication with the chairman of both of Indiana's major parties. They all know that I personally support postponing the primary election. I say this out of first concern for our county officials that have to conduct these elections, our poll workers, and voters themselves. And now the details have to be worked out, and the Secretary of State is running point on that. But I'll support ultimately the decision to postpone our primary election.
So we are in the process right now, probably in the next few days, of being able to actually give you information about individuals that are infected, individuals that are in the hospital, age ranges. I've had a lot of questions about the 2 individuals that died, and because we fortunately only have 2 deaths, I really don't want to give any more information because it's too distinguishable to those 2 individuals. But we are in the process of gathering that information, and we'll have some rough data for the governor, I think, later today or tomorrow. I think we're testing more people. I think that's part of the difference there. And again, I expect those numbers to go up, so I don't want people to be panicked about it. But when you look at the number that we have in Marion County, that is concerning to me. And so as we look at that, when you have a number of people that are sick and in the hospital, that's that top 15 to 20%. But we know there's another of 80% of individuals, right, that are probably mildly ill or may be totally asymptomatic with this virus. So that is why we have the need for the social distancing. That is why we really need to adhere to this so we don't infect more of our at-risk population. You're seeing that ramp up right now. You will see that over the weekend, for sure. Mm-hmm. I personally see a role for a clinic or an area where individuals can be tested that need to be tested but maybe do not need to be in the emergency room. I do not see a need to test the young, basically healthy person or even children that have these symptoms because that is not the population that we want to expend all of our resources on. So we are updating those numbers every day. We will have the numbers directly from our lab, and then oftentimes after we update that at 10 a.m., we will have other labs that are reporting to us positive cases, so LabCorp or other places, and we don't always have access to those. So as soon as we get those, they will go on the next day's numbers, and we will update. You know, I cannot say that specifically, but they should be Hoosiers that are being tested right here. That is something that we know individuals are infected in other parts of the United States, and they are, once you're infected, really have to isolate where they are. They are not allowed to travel at that point in time. So consequently, those numbers will get counted where they individually are tested and positive and isolate. So probably they were tested at an outside lab, and Tippecanoe County reported that to us without the knowledge that they were in Florida. So our hospitals to date have been equipped to manage what they need. We do know that a couple of them are getting into that area where we're concerned that over the next 96 hours or so they could start to run short of certain things, and we do have the ability to replenish some of those for the hospitals. We do have the ability to replenish for the hospitals. We are continuing to put out the message that we need to conserve our personal protective equipment. That's why we don't want every individual in the state doing one test with all their PPE on, throwing it away, and then 2 hours later doing another one.
Governor, do you have any idea exactly how much of a financial hit Indiana's looking at right now? You talked about holding back on those cash payments for university projects.
Yeah, we'll start to have a clearer picture about a month from now, obviously when the numbers start to come online, whether it's unemployment or budget numbers. Beyond the schools on May 1st? Not at this time, but we're open-minded, and we will, as you've heard me drone on about, we'll respond to the facts on the ground. Yeah. Not at the moment, but we'll make that decision when we make that decision. Because I'm relying on the commissioner and other members of the task force that we're not there yet. I haven't slept in a while. I'm awake all day and night. All of this is keeping me. Look, I talk to Hoosiers from border to border in different walks of life, and this has rocked their world, understandably. It has changed everything. And I want them to know, that's why I want to be in constant communication. Lieutenant Governor and I want to know what the individual challenge is, what the barrier is, whether it's unemployment or questions about where's my kid going to eat. We want to help them solve that problem. And, with millions of Hoosiers in the same boat, we got to look out for each other. So that's what keeps me up, is responding to every single question that comes in. And I think I can speak for everyone on this stage. It's the same true for them. Yes, ma'am. Yeah, that's something that the Superintendent McCormick and I will be in conversation about, the legislative leadership that you see here. We've set May 1st, and we'll reevaluate it and update you as we get closer. I alluded to said if twice. By some miracle, they're back. Look, when you look out and predict the wave that you referred to, or surge, I think you used, we're looking at 30, 60, 90-day increments, and we haven't crested yet. That's why everything that we're doing is trying to slow the spread so we don't overwhelm, so that we don't misuse these personal protective pieces of equipment. So that's why we're appealing to everyone's civic duty to make sure that we are social distancing, that we are doing everything in our own power. This is the single most important thing that we can do, is spread or slow the spread of COVID-19. Yes, ma'am. So, yeah. Well, they need to start somewhere, right? And this is up to $2 million, so that it's raining right now. There's a leak in the roof. And fortunately, again, this is not typical. This is a different speed of government in action. And more help is coming from the state of Indiana and from our federal partners. Also was in contact or communication with Senator Young, again last night and early this morning, technically about 1 a.m. And we are all moving in the same direction, and we are all trying to make sure that all of the resources are going to get to that individual who, the employee who may have been laid off or his world's changed, and the employer who had to lay that individual off, or that employer who's now unemployed. It's up to the $2 million loan from the SBA. There will be more that we'll announce shortly. Well, I'm discouraged to think that anyone would jeopardize someone else's health and safety. These are not measures that anyone wanted to take. These are measures that we have to take. And I would just appeal to their sense of decency to adapt to the facts. And should we need to take further steps, we will. Yeah. It's different. You want to take that, and then I'll comment too.
So presently in Indiana, we have about 50% of our districts who are one-to-one, so that's one child to one device. That does not mean that 50% of our districts have access at home or that they have take-home devices. So schools are diligently working on how to get devices home other than a phone, because when you ask families, are you connected, and they say yes, and it's a single phone, it's difficult to run e-learning on a single phone. So we're looking at access. We've worked with some partners. We've sent out free resources. There is a gap, and I'm not going to pretend that there's not one, but that's where schools have to make that difficult decision. Do they have the capacity as a community to run e-learning, or do they just have to close their doors and not run e-learning? So at this point, we're collecting data on how widespread e-learning is, so we have a better handle on what are those needs and what's happening with that practice at this point. Not necessarily. There will be some decisions that will have to be made. Obviously, that's a discussion that's going to take multiple agencies and people and legislative help. So we know we have a task ahead of us. We know there's an enormous amount of instruction. Even with e-learning, it's different. So there's instruction that's being lost. Our districts are doing and our schools are doing the best they can given the situation. But we will have to, upon reentry, someone asked about reentry. Upon reentry, those are the things that will have to be addressed. Our team has been in communication with those different higher ed institutions that partner with our local schools, and there are several. So they are having that conversation to locally determine what that looks like. Our goal is to get those dual credits to the students. I think the university, their goal is also to get credits to those students. So it's a partnership, but it depends on the higher ed institution, it depends on the local high school.
Right. So we are specifically doing tracing, but as more people get tested across the state and that result comes back and goes to their private practitioner, I will not, as opposed to in the past, have collected information about where they work, who else is in their home, and have other information. So I think it's important to start getting that messaging out there that we are available, our local health departments are available, we are continuing to follow this through. Our focus will be on those individuals that are working in healthcare and long-term care facilities, that work in long-term care facilities, those individuals that have exposed our patients, our individual Hoosiers across the state at highest risk. It's a very good question.
Right now, they're prepared. They've stood up to help us logistically, primarily. But they're capable of achieving anything. I've seen it before. And so if called on to do more than logistical support, then we'll address that, and you'll see that reflected in a future executive order. But we're not there yet. Well, again, I'm discouraged if businesses are not practicing social distancing. I've talked to a long list of businesses who have completely adapted their business model to see it through. I have personally, over the last 2 nights, gotten taken out food to restaurants that used to offer in dining, and now they've gone to order online, pay online, pick up, they bring it outside. And so I'm going to continue to, recommend and encourage Hoosiers to try to keep our main streets functioning, understanding that, not every establishment is a small business. There's some factory lines. We've been in discussions with folks who are increasing their shifts. There are a number of ways to continue operation in just a different way, and we're appealing to folks, first and foremost, to do the right thing. We're not there yet. If you're referring to sheltering in place from a state perspective, we're not there yet. We haven't addressed casinos extension yet, but it would be reflected, the extension would be reflected forthcoming.
Are you encouraging the state board of elections to eliminate the rules regarding mail-in ballots that have so many reasons?
You'll learn more soon from the Secretary of State on their agreed upon thoughts. We're trying to build consensus here. That's the best outcome for something as important as an election. Well, we're all learning a lot on the run, and we'll address every challenge and carry on with a sunny disposition. Look, this is an unprecedented time we find ourselves in. I was on the phone with 30-plus governors yesterday, Republican and Democrat. Governor Cuomo was talking about the escalation of change that he has to make on an hourly basis in New York. We're learning from what New York is doing. Governors were learning from what Indiana was doing. The best way that we'll see ourselves through this is with ourselves moving in the same direction. We've put out those guidelines. We've put out those recommendations. And where we need to enforce, if we get to that point, we will. Parks, state parks, we're not there yet. I mean, we've changed our, business in our restaurants at our parks. But again, if you're going to go out to a park, I would encourage that, but you got to socially distance. You can't go out there in droves, and whether you're in better shape than me or not, you can't go do a fun run with 40 other people.
Absolutely. I think that's an excellent question, and I think the last question is hooked to that. We have not said you cannot go out for a walk right now. Spread yourselves out, go out. If it's a nice day, go to the park. I think that's one of the best things you can do for your mental health. Get some exercise, be outside, be in nature. I think the other things you can do is you can read books to each other. You can play board games. Those things that our parents used to do with us as kids are things that are really important that we can now introduce our children to, besides just having their phones or their video games. I want to say there are certain populations that we're thinking very closely. I know Dr. Sullivan and I had a discussion about the mental health aspects of our elderly individuals that are now not allowed to have their families. And I know I have an elderly mother-in-law and my father, and I can't see either of them at this point. We would happily give them a device to use, but with the way their hands shake and their knowledge of technology, they couldn't do it. So how can we get a mental health professional in that is actually taking that to them so that they can be in connection with their families over their phones or another device? I can assure you that we have hotlines available and actually are referring individuals over. And I want to say that the heroes in a lot of this are our healthcare professionals that are on the front lines of this. And we've heard from several of them about how stressed they are, not just with the burden that they're seeing with health, the sickness, the level of sickness they're seeing, but also the underlying fears and anxieties that they have. So we're really trying to pay attention to that. So it's a very good question, and we're not ignoring that at all. Yes.
What's the advice for how to navigate all that?
Well, I think that's something that we've already given directions to coroners and to funeral homes, and we don't need to be having funerals of 100 or 200 people. So those may be things that get changed, delayed, altered in some way, and that's certainly things that we have been discussing.
Thank you for joining us today. This concludes our press conference. We'll continue to provide updates as information becomes available.